Hello, and thank you, Saskatchewan Seniors Mechanism, for hosting and organizing this. Thank you for showing up and engaging. I'm very glad to be here. My name again is Tamela Friesen with the Green Party in Regina-Lewvan. What are we going to do to save healthcare as the Green Party? First off, we're going to deal with what I think is the absolute most important issue of this election that nobody seems to talk about very much, and that is the state of our democracy. The foundations are completely eroded. They need to be fixed, otherwise anything we talk about here, we're not going to make progress on until those foundations are fixed. The Green Plan then, after we fix the foundations of our democracy, which includes more than just proportional representation, hopefully we'll get a chance to talk a little bit more about that. What we would like to do is reignite the health accord, reignite funding from the federal government, use that funding to leverage compliance with the Canada Health Act. Right now, a lot of abuses just go unpunished. But if there's 50-50 funding from the government, the federal government, that gives us a lot of leverage to encourage provinces to keep healthcare public, which is, I think, one of our greatest threats, is the growing privatization of various services. We want to expand it as well. We want it to include home care. Home care is 20 times more efficient than having someone stay in an emergency hospital bed waiting to go home or to have long-term care bed. So we want to expand home care, make sure that it's accessible whether you live in small town Saskatchewan or in Nunavut or Regina-Lewvan or anywhere else in the country. We want to make more long-term care beds available. There's a shortage. We need to put money into it. We want to support...
1 minute remaining.
Thank you. We support the CARP idea of trying to support seniors and aging in place. So that means that we need to expand the healthcare options to also include alternative therapies that are proven, and also to engage in alleviating poverty. So if we alleviate poverty, we expand healthcare, we get more money from the federal government going into healthcare, we strengthen the Act, and we enforce the Act, we're going to do a lot better for our seniors.